Welcome to Dewdear Academy. In this video, I am going to discuss about the important multiple choice questions from oncology nursing, and it will be helpful for you for the preparation for various competitive examinations in nursing, that is both the central and state government examinations. So let me start. First question: aquistic neuroma are tumors of dash cells. Aquistic neuroma are tumors of dash cells. Options: Schwann cells, Sternberg cells, glial cells, neuroglial cells. The correct answer is Schwann cells. Aquistic neuroma are tumors of Schwann cells. Aquistic neuroma is also called vestibular schwannoma, and these are the tumors that evolve from the Schwann cell sheath. Second question: blastoma is a cancer involving dash tissues. Options: bones, connective tissue, epithelial cells, embryonic tissue. Blastoma is a cancer involving dash tissues. The correct answer is embryonic tissue. So blastoma is a type of cancer that occurs in the developing cells of a fetus. It affects a type of stem cell known as precursor cell in a fetus. So here the tissues remain embryonic. So blastoma is a cancer involving embryonic tissues. Third question: which of the following tumor marker is specific for CA ovary? Which of the following tumor marker is specific for CA ovary? Options: CA121, CA120, CA125, CA135. The correct answer is CA125. That is, cancer antigen 125 is specific for CA ovary. Then question number 4. The most common risk factor associated with laryngeal cancer. The most common risk factor associated with laryngeal cancer. Options: chewing, alcoholism, smoking, tonsillitis. The correct answer is smoking. Smoking is the most common risk factor associated with laryngeal cancer. The next question: most accurate test to diagnose cancer of breast is. Most accurate test to diagnose cancer of breast is. Options: MRI, mammography, breast self-examination, myelography. Correct answer is mammography. It is an X-ray image of breast. Mammography is an X-ray image of breast, and it is generally the most accurate screening and diagnostic test to identify breast cancer. Next question: commonly seen electrolyte imbalance in a multiple myeloma client is. Options: hypercalcemia, hypocalcemia, hyponatremia, hypernatremia. Question is commonly seen electrolyte imbalance in a multiple myeloma client. The correct answer is hypercalcemia. Cancer-related hypercalcemia is the most frequent metabolic complication in patients with cancer. So it is associated with multiple myeloma and lymphoma. So hypercalcemia is the most commonly occurring metabolic complication of malignancy. Question number 7. Most common childhood malignancy is. Most common childhood malignancy is. Options: ALL, AML, retinoblastoma, Wilms tumor. Correct answer is ALL. ALL means acute lymphocytic leukemia or acute lymphoblastic leukemia or acute lymphoid leukemia. So ALL is the most common childhood malignancy. Then question number 8. Most common site of metastasis is. Options: lung, bone, liver, uterus. Most common site of metastasis. Correct answer is lung. Lung is the common site for metastasis, that is spread from cancer elsewhere within the body. Question number 9. Industrial workers exposed to vinyl chloride is at high risk for developing cancer of. Industrial workers exposed to vinyl chloride is at high risk for developing cancer of. Options: urinary bladder, liver, skin, lymphoid tissue. Correct answer is liver. Industrial workers exposed to vinyl chloride is at high risk for developing cancer of liver. Exposure to vinyl chloride is associated with an increased risk of a rare form of liver cancer called hepatic angiocarcinoma. So cancer is a major concern from exposure to vinyl chloride through inhalation. So inhalation is the main route of exposure to vinyl chloride. Then question number 10. Onion skin appearance is present in. Options: Ewing's carcinoma, rhabdomyosarcoma, primitive cell tumor, Wilms tumor. Onion skin appearance is present in. Correct answer is Ewing's sarcoma. Tumors of Ewing's sarcoma is characterized by onion skin appearance, and Ewing's sarcoma, it is a cancer that most often occurs in and around bones. So here the correct answer is option A, Ewing's sarcoma. Then question number 11. Site for bone marrow biopsy in an infant is. Options: tibia, fibula, femur, iliac crest. Site for bone marrow biopsy in an infant. Correct answer is tibia. For infants, anterior tibial site is used, and for children, iliac crest is preferred. So the advantage of tibial site is that it is a safe site, particularly in very small preterm infants, because it avoids any proximity to vital organs. And also tibia can be easily positioned without disturbing even the sickest infant, and it can be adequately stabilized and supported by the non-dominant hand of the person performing the procedure. So that is why the site for bone marrow biopsy in an infant is tibia. The next question. Persistent hoarseness of voice is indicative of. Options: laryngitis, tonsillitis, cancer esophagus, laryngeal cancer. Persistent hoarseness of voice. The correct answer is laryngeal cancer. So the primary voice symptom of laryngeal cancer is hoarseness of voice. Next question. Question number 13. Which of the following chemotherapeutic agent is associated with hemorrhagic cystitis? Which of the following chemotherapeutic agent is associated with hemorrhagic cystitis? Options: adriamycin, cisplatin, bleomycin, cyclophosphamide. The correct answer is cyclophosphamide. So cyclophosphamide is a cytotoxic alkylating agent, and high-dose cyclophosphamide regimen are often complicated by toxicities like hemorrhagic cystitis. It occurs due to higher concentration of bladder toxin acrolein, which is a metabolite of cyclophosphamide. So cyclophosphamide is associated with hemorrhagic cystitis. Then question number 14. Which of the following chemotherapeutic agent will lead to renal stones? Options: vincristine, 5-fluorouracil, chlorambucil, methotrexate. Which of the following chemotherapeutic agent will lead to renal stones? Correct answer is chlorambucil. Chlorambucil may increase the levels of uric acid in the body, and it can cause kidney stones. Next question. Usually bone marrow is aspirated from. Usually bone marrow is aspirated from. Options: femur, pelvis, iliac crest, humerus. Correct answer is iliac crest. Posterior iliac crest is generally the preferred site for bone marrow aspiration. Also, anterior iliac crest and sternum are used for adults, but the most preferred site for bone marrow aspiration is posterior iliac crest. So here the correct answer is iliac crest. So thank you for watching the video. Hope you like this video. Also share this video to your friends.